This is Dr. John Burroughs in Colorado Springs. I'm an oculofacial plastic surgeon, and I'm going to be showing my video for the mini incision facelift. Here you can see her before and after photos. First, you want to start with prepping the skin, and oftentimes before I do a facelift or with the facelift, I like to do dermal fillers to fill in areas that have become deflated. You just saw placement in the nasolabial folds and the glabella. You start your facelift by making an incision in front of the ear, which masks it nicely. And on the mini incision facelift, it doesn't wrap very far behind the ear. Next, you move on to the removal of the skin, which you know how much to remove based on how much lift you want to get along the jawline and the upper neck areas. Here you can see the tissue that's being removed. You then want to trim the tissue that's overlying the SMAS, which is the submuscular aponeurotic system, which is kind of the soft tissue structural support for the facial muscles and tissues. Once that's been cleaned up along the SMAS, you have a nice gliding plane that you can lift the tissues, and with careful deep suture placement, it takes the tension off of the skin and these incisions can heal very nicely. You can also tighten the SMAS through this incision in those cases when that's necessary, or even remove a small amount of SMAS. Usually I don't remove the SMAS, but it can be done. I like to stay above it because you stay on top and above the nerves to the face that control the movements of the facial muscles, so it's a safer way to do it. Here we are moving on to the chemical peel, which I like to finish with on many of my patients, and this helps tighten the fine lines, the skin, and help with pigment unevenness. For the eyelids, I like to use a cotton tip applicator as I find it more precise, and then as I move on to the rest of the face, I use a soft 2x2, and as you watch, you can see your skin start to get to a dusky white coloration. The great thing about the mini incision facelift is that it can be done in the office setting just with local anesthesia. Oftentimes I'll give a mild oral sedative, and there's not much downtime, though we do leave the stitches in for 7 to 10 days. This is a great procedure because of the very fast recovery, minimal bruising, and minimal downtime. It's quite comfortably done, and you get a great result along the jowls and also the upper neck. Thank you for watching.